My next guest has been on the front line as an emergency physician since Hurricane Katrina in 2005, specializing in humanitarian assistance and disaster response. Medical consultant for International Medical Corps, Dr. John Roberts. Welcome to Gamers Without Borders. First of all, how are you?
Thanks so much for having me. I'm doing great. The last, year and a half have been hugely difficult for a lot of people, especially essential workers and frontline workers. But over the last year since I've been working with International Medical Corps, it's been amazingly rewarding. And all of us are really excited about the future and the projects we have going on. So yeah, we're good.
Well, you're probably one of the few people that truly understands the extent of the COVID-19 response in the USA. So, how was your role at IMC impacted by the pandemic?
Well, International Medical Corps has been delivering healthcare since about 1984. We're currently active in over 30 countries, but when something happens at home, in your backyard, that's a massive perspective change. You know, Previous responses, we, go somewhere, do our jobs, and we get to go back home. But when it happens in your home, there's no reprieve, and so it takes a different way of looking at things and a whole different mindset. So
Well, you also aid in the recruitment of staff as well for IMC. So this past year, have you had to expand your team due to the scale of the response required?
not the breadth of the team. We've been helping out with pandemic responses and outbreaks, cholera, Ebola, pandemic flu, for years. But just given the whole scale of things, yes, we absolutely had to increase our numbers. We had to massively increase the numbers of infection prevention and control staff we have, infectious disease experts, water sanitation and hygiene experts, and then also volunteer doctors and nurses. We had to significantly increase the numbers that we had to help cope with just the massive scale of this.
Well, you've mentioned that IMC has been responding to pandemics for years now. So has the approach to this particular pandemic, being that it's global, been any different?
It's absolutely 100%. It's not just the numbers of people; it's also the wide span of different types of people from all over the world. Every country in the world has been affected by this, and so we have 30 country missions right now, but we've had to significantly increase our ability to go everywhere to every corner on the planet and really try and get to the people that are vulnerable and find out what they need and try to help them out with that.
We've discussed some of the amazing work that you've done in 2020. So now let's look to the future. Let's look to 2021, the rest of 2021. Vaccine distribution has got to be on everyone's mind. So how are you working with IMC to ensure that as many vaccines get out as fast as possible? And how has Gamers Without Borders program contributed to these efforts as well?
Well, we've actually been working with COVID vaccines since January. When the first vaccine came out, the first thing we did was try and pivot to figure out how we were going to engage there. So over the last several months, we've been pivoting from helping out hospitals and providing direct care to working with organizations like COVAX and other partners to develop plans for cold chain support and last mile vaccine delivery, which is basically where we take the vaccines from the distribution centers and actually get them to the people. Governments are really good about moving things from place to place, but when you're really getting into vaccine distribution and trying to get it into people's arms, that's where we come into play. We also provide help with logistics, administration, training, mobile vaccine clinics, and trying to really bring each country's ability to deliver vaccines up to the best possible place it can be. We actually just We actually just started doing or we've been doing a project since February with Kedron Community Health Center in South Los Angeles, and we've been able to deliver over 150,000 vaccines to some of the most vulnerable in LA. And most importantly, support from our donors has been absolutely paramount to help us do our job. So, yeah.
Well, like you've already mentioned, IMC has been a key preventer of outbreaks and pandemics for numerous years. So that you're extremely vital. Your resources are extremely vital, especially in times like these. So you're doing your part. What can we do to help at Gamers Without Borders? Our viewers, our players, people like myself, what can we do?
Two things really. The first thing is educate yourself on the vaccines and on this virus. There's so much misinformation out there, from that it was started by 4G, 5G, to Bill Gates created it. Like, really, really understand the origins of this virus from reputable sources, and also educate yourself on the vaccines. Some of our most important work is getting the vaccines into people's arms. So learn about these vaccines, talk to your friends about it, have those hard discussions, and really understand what the most important thing and the most valuable thing for you and your family is, and have those discussions and with your friends and the people that you love. And then, most importantly, for us at least, is we cannot do this without the support of our donors. It is vitally important that we are able to continue to do the work that we're doing. So, internationalmedicalcorps.org is our website. There is a big, huge donate button right up at the top. Give whatever you're comfortable giving, and whatever you give will make a difference, I promise you.
Educate yourselves, spread the word on social media, and donate as well. Thank you so much for joining me on Gamers Without Borders, Dr. John. Honestly, you have such a vital job. You must be so busy. I really appreciate you taking the time to sit down and have a chat with me. And best of luck at IMC for the remainder of 2021.
Thank you so much. It's been a pleasure.